dear viewers, this is Dr. Varun. I am consultant endocrinologist at MagnaCentres. In today's video, we will discuss regarding diabetes and thyroid. What is the relation between these two? Both diabetes and thyroid problems are very common issues nowadays. So we will understand what's the relation between these two. Is there any association between thyroid dysfunction and diabetes? Yes, there is a definite association. However, this association is not causative. So patients with diabetes tend to have higher incidence of thyroid dysfunction, and vice versa is also true. Especially patients with type 1 diabetes, they tend to have a higher incidence of both hypothyroidism and hyperthyroidism, because the mechanism of the disease, that is autoimmunity, is common. So it has been found that almost around 20 to 30% of patients with type 1 diabetes tends to have a hypothyroidism. So patients with type 1 diabetes need to get a screen for thyroid dysfunction periodically. Whenever a patient with type 2 diabetes has some clinical or laboratory evidence of markers for like hypothyroidism, they should be tested for TSH levels. The blood glucose levels in patients with thyroid dysfunction also get affected. Patients with hyperthyroidism, that is the excess of thyroid hormone, tend to have higher incidence of diabetes, and there can be a worsening of the diabetes control in patients with new onset hyperthyroidism. When it comes to hypothyroidism, the fasting sugar levels tend to be slightly low. However, the post-absorption of the blood glucose, the food, gets slowed down. That's why the post-absorptive sugar rise will not be that much in patients with hypothyroidism. Especially if previously controlled diabetic patient who is on insulin is now getting very low sugars with the same dosage of insulin. One of the consideration is hypothyroidism. Hope this video has been informative for you guys. Please check on the other videos about thyroid dysfunction as a part of the Thyroid Awareness Month. Thank you.